Effective instructional environments clearly can prevent learning disabilities, particularly when they're done in kindergarten, grade 1. You can even start in preschool. In preschool, we should have oral language curriculums that include exercises that involve attention to parts of words, like rhyming. For example. So the child learns to listen to internal sounds that words would make. I'm not talking about teaching phonics to four-year-olds or anything of that sort. I think actually exposure to a broader oral language curriculum for all children, but particularly children who are at risk because they go to Head Start or Title I schools or things of that sort are particularly important. In kindergarten, the curriculum needs to include exposure to phonological awareness, which is overarching understanding that words have internal structures that are related to sound. They need exercises and games that help them develop that skill. There's good experimental evidence that shows that children who are exposed to phonological awareness teaching in kindergarten develop better reading outcomes in grades 1 and 2. By the time you get to grade 1, you need a good, strong core reading curriculum and teaching practices that allow teachers to differentiate instruction according to children's individual strengths and weaknesses. So a good core curriculum includes explicit instruction that's teacher-led, where the teacher models and demonstrates what the child needs to learn. It includes explicit instruction in phonics, which is the rules where letters and sounds are connected. It doesn't have to be drilling. It's a mischaracterization to say that every child needs to be drilled in phonics in isolation because a good core curriculum includes components that promote practice and opportunities to read, engagement. It should include comprehension exercises. And so we talk about good, strong curricula as including phonics, fluency, and comprehension that are integrated in a meaningful sort of way, not in a balanced way. That means phonics in isolation, comprehension instruction in isolation. That's much less effective than an integrated program. And then for children who don't respond adequately, particularly in first grade, they need a tutorial type of intervention. They need to spend 90 minutes a day in language arts instruction, and they need another 30 to 40 minutes in small group instruction. That is the most powerful way that I know to prevent a reading problem. In studies that we've done, we've been able to reduce the number of children who are at risk from approximately 20% of first graders to 2% of first graders just through this tiered, layered intervention. Strong core instruction for everyone, which absolutely reduces risk, and then you reduce risk even further by increasing time on task and increasing the amount of differentiation. And this occurs in the context of universal screening and progress monitoring. Then some children, and it should be a very small number of children, if you have a strong core curriculum and effective tutorial interventions, they need some type of intensive intervention. And that will often focus on a component skill that the child has not learned. It might focus, for example, on very intensive instruction in phonics. It could focus on very intensive instruction in fluency. It could be very intensive instruction in vocabulary if the child is able to decode but can't comprehend. And those need to be probably an hour a day. Sometimes they need to extend for years, and if the child isn't reading on grade level, that child has a persistent reading problem, and that's probably a disability at that point.